Thank you, Mr. Chairman, and I think you know how much we're going to miss you next year. I'd almost like to anchor you to that chair, because if we're going to deal with these issues, your voice and your influence is key, and I thank you for all your courtesies over these many years. Gentlemen, I'm going to start with Medicare, because the rights of senior citizens have been my overriding passion in terms of public service, and we better be darn passionate about this subject, because protecting the Medicare guarantee, especially right now when the trustees have said that Medicare isn't going to be able to pay the bills in 2024, means that we're going to have some bipartisan action here on Capitol Hill and soon. And it seems to me that getting that bipartisan action is going to require accepting some key facts about how the program actually works today. For example, when you hear Medicare discussed in the media, TV and elsewhere, Medicare is often described as solely a government program. Now, the facts show otherwise. In my home state, for example, almost 60% of the senior citizens secure their Medicare guarantee through the private sector. This is Medicare Advantage and private Medigap plans. So the first challenge is to get an agreement on some of these key facts, and then the question is really, how should we go about securing the future of the program? And I'd like to start with you, Dr. Nichols. You've done good work on this in the past, and ask your thoughts about what I think are the three key principles for strengthening Medicare for the future. The first is keeping traditional Medicare for all time as a robust option, so that then you would have the government's purchasing power and private sector innovation making each other better. That's principle number one. Principle number two is guaranteed affordability and choice for everyone on Medicare by requiring that the government's contribution for their Medicare provides the same benefit that they get today. I am not interested in providing any senior citizen in this country with a coupon, and I've always rejected it. So with principle two, we can make sure that doesn't happen. Principle three is ironclad consumer protections that stop cold anybody who tries to fleece a senior or tries to game the system. And that also means you kick somebody out when they are trying to cut corners and not complying with the rules. So the question for you, Dr. Nichols, is regardless of what you call this, and you've correctly said there are a lot of ways you can name this, regardless of what you call this, are those the kind of core principles of a Medicare future, in your view, that can actually work, be bipartisan, protect the Medicare guarantee, and get us on top of this challenge?
Well, Senator Wyden, you know, I think we might have talked about this in the past, and I've said this in public. Both God and the devil are in the details here, so it really does depend. I know if you're in favor of this, if you add risk adjustment to those principles to make sure that the competition is on a level playing field, and I know you're for that, then it would indeed be, in my view, a linchpin of how what you might even call pro-beneficiary competition, to throw a new word out there because we've gotten so confused about the other ones. Because it would indeed, in my view, as you put it in the first principle, enable the private sector's innovation and creativity to be buttressed by the public sector's guarantees and indeed its own innovation. You know, my colleague Jim here talked about how Medicare is the biggest buyer. That's actually in some ways an advantage because Medicare can drive, therefore, an incentive realignment. Yes, Medicare's payment schedule is what's out there, but private plans adopted it because it was more efficient for them to have the fee-for-service schedule come from Medicare than to develop their own. So, in fact, when Medicare does innovation on paying hospitals or now paying physicians differently, we get progress that way. The private sector can benefit from that, and that's exactly the kind of dovetailing I think you're talking about. But the principle of pro-beneficiary competition, where you maintain those provisions, to me, that's about as good as we're going to get.
Well, thank you very much, and I'm very pleased that you also mentioned the risk adjustment, factor. That is absolutely key in any approach that, in effect, tries to place side by side government's purchasing power and the innovations that come from the private sector, because if people are going to, in effect, be empowered to have that choice, you're going to have vigorous risk adjustment, and I really appreciate your pointing that out as well. And you're right. You can call this a variety of different things, and we hear all these names essentially slung around almost indiscriminately, and that's why I appreciate your saying that those core principles, and I think those are the kinds of things Democrats and Republicans can talk about together, are what's needed for ensuring the Medicare guarantee for the future. One question for you, Dr. Cutler, and I've long admired your work, as you know, is Senator Grassley and I have introduced a bipartisan proposal to open up the Medicare database. This, of course, is the database that ensures that the procedures for which providers and doctors are reimbursed, that database would be available to the public so that the American people, in effect, could go online in a fashion that would protect the privacy rights of each senior citizen, but that information would be made available to the public. Would you be in support of the kind of efforts Senator Grassley and I are making there?
Thank you for the kind words, and the very short answer is yes, absolutely. It is fundamental that we be able to understand what's happening, or to put it in another way, no business ever got better without knowing what it was doing.
You're being logical. Mr. Chairman, thank you for the time, and again for all your courtesies on this issue and so many others.
Thank you for your extremely hard work. I appreciate it very much.